Hello everyone, this is the Mental Health for Life channel. 70% of people we lose to suicide never leave behind a note. Since we don't get this chance to hear from the deceased, in many cases the true reasons for their suicide ultimately remain unrevealed, though the cause of suicide is eventually inferred for about 70% of suicides after interviewing the deceased's families. It seems suicide is often not caused by just one singular issue, but by a combination of issues that are often related to money, family, and work. Adding to this, a significant number of those that choose to commit suicide lived in desolate situations, such as living isolated, alone, or unemployed. Suicide and loneliness are closely related. We also know that more than half of suicide victims suffered from some mental illness or disease. Half of these cases involve depression, which accounts for a majority of them, followed by schizophrenia and alcoholism. Just because one receives treatment from a medical professional does not mean that they are free of risk. A person might grow more impulsive while undergoing treatment or be devastated emotionally in the wake of their diagnosis. In some cases, they might look to abuse medication for suicidal purposes. Many emergency rooms have patients who attempt suicide by jumping from heights or attempted to overdose, only surviving on the brink of death. Once patients have physically recuperated, psychiatrists ask them why they attempted suicide in order to draw a mental health plan. However, curiously enough, most of them do not remember what happened before or after the incident. Many seem to have just been in a panicked state after experiencing a series of distressing events, and the next thing they know, they are in a bed in the emergency room. At the time of their suicide attempt, they were confused and not in a normal state of mind. Normally, thoughts like, "it's going to hurt," or "my family will be devastated," are present to help deter people from any suicide attempts, but sometimes those inhibitions may no longer be present. People might lose the will to live after a combination of unfortunate events such as debt, work mishaps, heartbreak, and bullying. People who have depressive or schizophrenic disorders which may be accompanied by suicidal thoughts. People who have been obsessed with suicidal feelings since childhood. These kinds of people tend to attempt suicide once they go through some triggering event. Triggers also often consist of relationship problems such as a betrayal by someone you once relied on, a breakup with a partner, rejection from friends, a quarrel with family, and so on. Excessive alcohol and medication use, or the use of many kinds of illegal drugs, may suppress one's rational mind and make it so they can't help but behave impulsively. A person who detects the warning signs of suicide and prevents it from happening can be called a gatekeeper, in the sense of being a gatekeeper of life. The more gatekeepers there are in the world, the fewer suicides there will be. To help everyone become a gatekeeper, we'll share the 9 signs that might indicate an individual is at risk of attempting suicide. 1. Behavior changes. Their face might look bleak and their mood might be unusual compared to what it once was. They may be emotionally unstable and grumpy or bad-tempered. Contradictingly, they can also show unusually cheerful behavior. They may lose interest in things they used to be interested in and stop participating in their recreational activities. They might even grow indifferent about their appearance. A person may have previously been well dressed, but then they may no longer apply makeup and might not even care about wearing the same clothes several days in a row. 2. Suicidal implications. Some might express their desire to die openly, while others may imply it with phrases that suggest suicide, such as, "I don't want to be alive," "I wish tomorrow never comes," or "I want to go somewhere nobody knows who I am." They may look up suicide and methods on the internet, make a concrete plan, and purchase charcoal briquettes or chemicals. They might write a suicide note on their computer or visit common suicide spots. They might also tidy up their possessions and might hand off their prized possessions to others. 3. Alcohol abuse. They may begin to drink more than usual, and every day they might binge drink themselves unconscious. Intoxication also occasionally leads to accidents and injuries. Excessive drinking also results in a loss of reason. Many people who die by suicide are intoxicated. 4. Risky behavior. They may take drugs over the prescribed amount. Sometimes they might mix alcohol together with drugs they shouldn't and lose consciousness. They may drive in reckless ways like drunk driving. They may also begin to abuse illegal drugs. 5. Physical illnesses. They might claim to have physical symptoms such as loss of appetite or weight, sleeplessness, headaches, other body aches, and so on. These might be early signs of depression or schizophrenia. If the person is already undergoing treatment, it may suggest that they quit taking their medication or their medical condition is worsening. 6. Social withdrawal. They may withdraw at home or work and stay mostly at home. They might not answer phone calls from friends who might be concerned for them, and they also likely won't socialize and become socially isolated. Loneliness is a major factor in suicide. 7. Sudden flight, disappearance, or wandering. These actions might suggest impulsiveness. It may be a dissociative symptom in which you lose awareness of yourself and wander about elsewhere as if someone else is controlling you. This is a hazardous condition with a high risk of suicide. 8. Conflict with family and friends. They may start to fight with family, friends, or loved ones over trivial matters. When agitated during fights, they might become more impulsive and the risk of them committing suicide increases. In one incident, during an argument between a parent and a child, the child spouted off, "I'm going to throw myself over the balcony and kill myself." And the parent responded, "Do it if you can." The child then threw themselves over and committed suicide. 9. Death of a family member, friend, or someone they admired. When a beloved one like a family member or a significant other dies suddenly, or when a celebrity who they admired died by suicide, the person suffers from a great loss and might attempt suicide as if trying to follow their beloved one's lead. These are the 9 characteristics of people at immediate risk of suicide. A person seeking death might appear to be selfish in the eyes of people around them. So without knowing, you might accidentally drive someone into a corner by ending up in an argument with them. If a person you confronted in an argument chose to end their life following the argument, you will regret the decision for the rest of your life. If you recognize any of these signs we shared, consider not fighting with them. Instead, offer your help to them. The first thing you should do is try to listen with a calm mind. This was the Mental Health for Life channel. If you liked this video, please give it a thumbs up and subscribe to our channel.